In terms of lung cancer screening in the UK, as a surgeon, the issues are really around who's going to do it, do we have enough surgeons in the country at the moment, and how are we going to do it? Are the methods that we're using at the moment to resect lung cancers the same as the methods we should be using for people who are going to present with an earlier stage lung cancer? So in terms of the who's going to do it, do we have enough surgeons at the moment? Probably not. So it's estimated that there will be up to a 50% increase in the number of lung cancer surgeries per year. So we might need an extra surgeon per centre to cope with that. But it's not just about the extra surgeon, of course, it's about having the theatre space and the ward space and the nurses and and everything else that goes with appointing a surgeon. So that's one thing. In terms of how we're going to do it surgery-wise, minimally invasive surgery. So the UK already has a very high proportion of lung cancer operations done by a minimally invasive technique, around 50% or so. Within screening programs, we know that can get as high as 85%. We've just got, there's an important study will be published in the next couple of years from the UK, hopefully showing that minimally invasive surgery is beneficial to the patients when compared to open surgery. So minimally invasive surgery, and then we're going to try and spare as much lung as possible for the really small nodules. So rather than taking half a lung away, can we take just a tenth of the lung away, something called a segmentectomy? And again, we're waiting on some studies coming from North America, from Japan, to tell us that's a good thing and equivalent to taking half a lung away.